Dr. Cruz, how would you describe the role of technology in your office? What role does it play in the care of the patient?
It's it's a massive role in our office, but it actually requires a little bit of kind of unpacking. I wanted to make sure that when you came into our office, that the technology that we used wasn't necessarily in your face, and I wanted to make sure that the technology that we use doesn't detract or pull away from the human interaction. I mean, I think, a lot of us can agree nowadays that when you think about technology, cell phones, social media, it actually is kind of pulling away or detracting from our ability to really make connections with people. And so we have a ton of state of the art technology kind of built into our practice, but the way I would describe it is it's thoughtfully integrated to where you're not necessarily going to see this technology. And so it comes from things like the way that we scan teeth, or the technology in the braces that we use, or the way that we remotely monitor our patients. I mean, the list goes on, and we can talk a little bit more about that. But when you walk into our office, it's sort of homey, it's warm, it's comfortable. All of our staff members are happy and friendly, and so I sort of pride ourselves on the idea of you not being able to see this technology, but it's definitely there.
You've moved away from traditional impressions. Can you explain how the digital scanning works and why it's better?
Sure, yeah. When I hear about impressions, I can't help but laugh, only because there was a time where we would try and hype up impressions by offering different flavors and try and make it fun and exciting. But the truth of the matter is, impressions are not fun. I mean, anybody that has had impressions can sort of relate to the idea that, it's a little uncomfortable. You've got to worry about gagging, et cetera. And so, yes, with scanners now, there's a few things to sort of talk about. One is much, much more comfortable. And so, especially for some of our smaller, younger patients, you can do a scan and it's not bothersome at all. The other thing is how incredibly accurate they are. So, even good impressions aren't even close to being as accurate as the scans. The fact that we have a couple of scanners in our office doesn't necessarily make us special. I would say that 90+% of orthodontic offices have these scanners. The real question is, what do you do with those scans? And so that's what makes us special. So we use those scans to do a number of things, whether it's then printing 3D models of the patient's teeth so that we can then make special appliances off of those models, or actually put braces on those models and create a tray that we can transfer to the patient. We also use those scans to integrate into remote dental monitoring. All of our patients get something called a scan box. And so there's a lot that you can then do with those scans. And in my opinion, a lot of offices aren't really scratching the surface, because you've got this incredible data with regards to the patient's teeth, their bite. And so what is it that you're going to do with that scan? And so that's what we do, is we try and take it to the next level and use that scan for the patient's benefit.
How using this 3D imaging in diagnosis and treatment, how's it helping with that?
It helps tremendously. So the way that things typically were done, at least in my office, is that in the beginning you would have a set of records, photos, x-ray, maybe some study models that were made out of plaster that you'd gotten from an impression. You'd sit down, you'd look at all of that, and you'd come up with a treatment plan. And then oftentimes that treatment plan really isn't revisited on a regular basis to make sure that that patient's treatment is on track at each and every appointment.
Hmm.
So now when you have these 3D images and you then combine it with things like dental monitoring, you can make sure that this initial treatment plan that you come up with is on track. And so at least in our office, I'm continually using these 3D images and making sure that the patient is efficiently going through treatment, and that's unique. And so, once again, I know I keep referring to this dental monitoring. That has been a game changer within our office. Making sure that every single week when a patient does that scan, we can review it and make sure that things are going the way that they're supposed to be going. That's a big deal, Oftentimes, the way that it works is you'll do an adjustment for a patient, and then you won't see them for a couple of months. And it's sort of a mystery of like, well, how are things going? Are they comfortable? Is anything
Hmm.
bothering them? Are the
Hmm.
teeth moving in the right direction? How does the bite look? And so a lot of these questions don't get answered. And then they come into your office and you're sort of unprepared to be able to handle what it is that they present you with. That is completely eliminated in our office now. So with our ability to be able to use these 3D images and then track and monitor them every single week, we're able to offer just much better service.
How does the technology allow you to have more customized treatment for someone with getting braces or Invisalign?
Once again, we're going to talk about dental monitoring again, because that's where
Yeah.
AI has really been adopted. It's one of the few companies, at least in the orthodontic field, that's really embracing AI. And so there's a limit as to how much I can talk about, only because I'm one of the beta testers. But dental monitoring is coming out with newer and newer products that are going to be incorporating three-dimensional scans into the weekly scans that patients do. And so why
Hmm.
all of this matters is that, there's a big difference between looking at a two-dimensional picture and trying to treatment plan off of that and trying to anticipate how the teeth are going to move. But to have a three-dimensional reconstruction every single week of where the patient's teeth are, where they've been, being able to play videos to see the trend in the movement of the teeth, then helps you predict the direction that they're then going to continue to move into. And so that's one of the things that we've been using a lot lately. And so the other thing that's really been great with regards to the AI is being able to pick up on issues that patients are having, whether it's infections or cavities or a brace that is broken or a wire that is poking. Constantly, these scans that are being taken, the data from them is being used by AI to get better and better. And
Yeah.
so once again, oftentimes we're able to call our patients and let them know about something that we've noticed that they're not even aware of, because we're able to kind of catch it so early.
That's amazing. Is it allowing
Yeah.
you to do like a simulation of what's going to happen in the future as well? Is it aiding in that?
Absolutely. And you can do that as well. And it's worth talking about too, because for so many years there's been attempts at that. Invisalign has made attempts at it. And
Yes.
for a lot of years, those predictions were really unreliable, right? And it makes sense when a lot of these technologies are in their infancy. You just can't completely rely on the fact that the teeth are going to move exactly the way that that computer model predicts it is. But I must say, in the last year or two, it has gotten incredibly more accurate. And so now you can lean on it and you can rely on it and you can show patients. There was a
Yeah,
time
that's
where
what I
I
was
was,
going to ask next. Because if you give someone the wrong expectation, that's recipe for disaster.
yes, thank you. So that, there was a time in my career where I would show these predictions, and they were not accurate. And so then there was this conversation of, hey, you showed me this and that's not what I'm seeing. And so there was a time where I then sort of abandoned it because it wasn't reliable.
Well,
But
yeah.
now we're able to kind of re-embrace it because it is getting much, much more predictable.
And that's just happened in the last couple of years, you'd say.
Absolutely. Yep.
That's amazing. Okay. So, what are some of the ways technology has made the patient's actual visit more comfortable or efficient?
Good. Yeah. Comfort specifically is a few different things. One is, what are the braces or aligners that you use, and what are the wires that you use with those braces?
Hmm.
What do you offer your patients to take home with them in order to be comfortable? And so those are the questions that we've been addressing over the last several years. And so, the appliances and the aligners that we use are the absolute best. And there was a time where we thought in orthodontics that more pressure was a good thing. It's going to move teeth more quickly, but it turns out that's not the case. So if you use wires and appliances that apply light constant force, it's actually more comfortable for the patient and it's more efficient too. So those are some things that we've learned. We also use something called the dental pain eraser, the Synapse. And that has been amazing, especially for our youngsters. They'll have an expander or they'll have braces placed, and they're concerned about how sore they're going to get. Parents are concerned about how sore they're going to get. What can they eat? And so this uses, it's a fancy word, but it uses neuromodulation. So it basically tells the nerves to relax and to calm down. And so
Yes.
patients don't have to be sore like they used to be. And so these are a lot of things that I think orthodontists should be adopting, and they're not. And I think that you'll see that shift, that change over the next 3 to 5 years.
Amazing. All right. So do you have technology that helps reduce the treatment time and or the number of office visits?
We absolutely do, significantly. And I think we've talked about this in the past. It wasn't uncommon to have braces. I mean, when I was a kid, you'd have braces on for 2, 3, 4 years, right? It would be a
4 years.
lengthy
Woo.
process.
Yeah.
And so those days are over. I'd say on average, most of our patients are in treatment a year and a half, maybe even a little bit less than a year and a half, depending on what we're doing. And a lot of that has to do with not so much changing the biology of how you can move teeth. There is a limit as to how fast you can move teeth. Those are just the limits of what's physiologically possible. But what you can control is that when a patient comes into an appointment, that appointment is intentional. Everything that you do at that appointment is going to help with regards to getting from point A to point B. And so what used to be really common is patients would come in and there would be these very minimal adjustments that you would do. And so it would take 20, 25 appointments to be able to finish treatment. Now we can have treatment done in 8 to 10 appointments. And so it's great on so many levels in that, one, it's fewer appointments overall. Everybody's busy, right? Whether it's sports or school or work, it's hard to get time off to be able to come into the office. And so we're able to see our patients every 10, 12, 14 weeks, which is great, but not compromising on the standard of care, still offering excellent service. And so the key to all of that, like I said, it's not being able to move the teeth any faster, but it's making sure that each appointment, you're maximizing what needs to be done so that you're not slipping through the cracks. Yeah.
Yeah. All right. So what about tracking patients between the appointments? We've talked about this a little bit. Can you explain, like, what is the experience with the office between the appointments? What are y'all using with these dental monitoring scans? How are they helping you actually take care of the patient between physically seeing them?
Exactly. So the first thing that's worth talking about is they have tremendous access to myself and my staff, right? And so I tell every single one of our patients, when they get treatment, when they start treatment, they get their braces, they get their aligners. I said, use that app and message me anytime. I don't care if it's after hours. I don't care if it's on the weekend. I want to make sure that you feel comfortable in knowing that you've got access to me directly. And so the way that the dental monitoring app works is we set it up so that when a patient messages through that app, it goes straight to my cell phone. And so most patients look at me and go, really? And I said, absolutely. Because inevitably, when something goes wrong, it's going to happen on a Saturday. The office is closed. You're confused as to what you do. Maybe something uncomfortable is going on. And so it has been tremendous for our patients to be able to have access to me. And it's amazing too. Families don't abuse it. They're not texting me at 2 in the morning just to see if I'm really checking. But they're always so grateful. We've been able to handle patients that are out of town, out of the country, resolving issues and problems. And, their appreciation is so high. So there's that aspect of it. And then the other is being able to every week see exactly what's going on and being able to then use that information to figure out what needs to be done at that next appointment. That is such a critical key ingredient. So the way that it used to work is that orthodontic offices tend to be fairly busy. You see 70, 80, 90 patients a day. So this expectation that you're going to be able to sit down with a patient, figure out what's going on, and then very quickly come up with a plan and not miss any details and do that 80 or 90 times a day, that's an unrealistic expectation on an orthodontist. And so the way that we use that technology now is that I'm able to, in a quiet environment at home, review these scans, really take the time and see what's going on, and then also come up with a plan for what we're going to do at that patient's appointment. And so we still get to have this human interaction when the patients come in. We have this quality time with the patients. And then I also am able to make sure that I'm not missing any details. And so I couldn't do that if I didn't have those scans, if I didn't have that technology.
What about communication with the patient through the whole treatment process? What are all the ways you are pushing information to the patient just to let them know what's going on?
Yep. You can call us, you can text us, you can message us through the app, and we want to make sure you can email me, or you can send a smoke signal. We really want to make sure that you can get a hold of us. I mean, I can't tell you how many times we've had patients message me through the dental monitoring app, and it's 9, 10 o'clock at night, and they just figure, well, I'm just going to get the message out before I go to bed, and then I'll get a response sometime the next day, and I'll respond back within a minute or two. And I sort of enjoy it because they're shocked, like, oh my gosh, I'm sorry, I didn't mean to bother you.
Right?
But I really want them to know that we are here for them.
Yeah.
And so it's also awesome because what happens is you start developing relationships with these people. And so you get to know these people really well as a result of it. And so, yes, communication is key. You do not want people to feel like they're alone in this process.
All right. So there's so much technology and potential innovations in healthcare. How are you deciding which things to bring into your practice?
That's a tough one. That I have had issues in the past where companies have overpromised and underdelivered. I won't go into the detail of all of these different products that are going to solve, orthodontics. And so what I've learned, in the 20 years that I've been doing this is that I'm definitely guarded before I adopt a technology, and I want to make sure that it is legitimate.
Yeah.
I've got colleagues, friends that I trust, and so we'll get together, we'll talk, we'll communicate. There are study groups. I'll read literature to make sure that this is legitimate. And so I'm not as quick to adopt technology as I used to be, because I want to make sure that before we have our patients, use this technology, it works. I don't want our patients to be a guinea pig. And so, yes, we have definitely adopted some big changes into our office these last year or two, but it was many, many months behind the scenes of me vetting this to make sure that it was legitimate.
So, Dr. Cruz, what a new or emerging technologies are you excited about right now?
Uh, it's good timing for that question, actually. I have a wire bending robot that is being delivered to us. It's actually at the port of LA, I believe. It's shipped
Yeah.
from Korea. This is going to be some amazing technology. And I've been looking into this for a while now. But going back to the scanner that we were talking about, what do you do with those scans? And so
Yes.
imagine now a patient that comes in, we scan their teeth. That scan gets uploaded to a computer. I then get to adjust the position of the teeth in real time. And then I press a button, and then the machine, this robot, will bend a wire to then straighten the teeth all within that same appointment. And
Wow.
so it's pretty amazing technology. It should be delivered any day now, And so I'm really excited. We got everything prepped for it. We know where we're going to put the
Yes.
robot in the office, and so that is one that is really exciting, because when you think about how we normally bend wire,
That's what I was going to ask next. How does it normally work?
it's normally done by hand, and there's a big spectrum as to the skill set that every individual has with regards to their wire bending skills. And I'm not the greatest wire bender of all time, right? And you can never compare to the precision of something like a robot that can get things down to the micron. And so um, this is going to be able to also increase the efficiency. So an example would be that you make a bend, you're trying to move the teeth, and then the patient comes back and you think, oh, I made the bend a little bit too small, or I made the bend a little bit too big. And so
Mm.
you have to undo it and you have to fine tune it. And so now, instead of making the bend exactly right in that wire the first time around, it might take 2 or 3 or 4 appointments to get the teeth exactly where they're supposed to be. And so
Yes.
now imagine a robot that says, look, I got this. I'm going to make the bends exactly the right size that they're supposed to be, and that you can do it all in one appointment.
So normally it would take more than one appointment.
Absolutely. Yep. Normally it's a few appointments to do what we call that detailing phase. And in my
Sure.
opinion, the detailing phase is arguably one of the most important. It's very easy to put braces on, and it's very easy to put these initial wires in and just sort of roughly straighten the teeth to where it's like, yep, I see an improvement. But where you really start to see the differences between kind of a good office and a great office is the finishing, the detail. And you'll notice that in the smile. I mean, the eye will pick up on, wow, that smile is beautiful. I'm not exactly sure what the specifics are as to why that's so perfect, but it really is. It comes
Yes.
down to these little details. And so these finishing appointments that are usually 2 or 3 appointments can now potentially be done in one and be done better. So yeah, that has me excited.
Wow. So you'll be reducing the appointments even more and
That's
reduce
the
treatment
goal.
time.
Yep. Yep. And
That's amazing.
it really is amazing. We're going back to what we were talking about with this technology being integrated. I love the idea too that the patient doesn't necessarily have to know about all this stuff. We're not going to put the robot in their face and show them,
Yeah.
I think it's cool stuff, but and it's worth them knowing that we have this amazing technology, but it's still not preventing us from having this awesome interaction with.
So this step is happening after the bonding, obviously. The bonding is where you put the bracket on the teeth. So can you explain, you guys do indirect bonding?
We do. Yep.
Can you explain that just briefly? Because that's also reducing a step, isn't it? Or time in that step.
Reducing a step and also improving comfort and length of appointment. So we take that initial scan, and what we were saying earlier is, well, what are you going to do with that scan? You've got this
Yeah.
information. So we use that and we send it to a 3D printer to print a very accurate model of the patient's teeth. And then I position the brackets, I put the brackets on that 3-dimensional model, and we make a tray that wraps around all of that. So the old school way of doing things is we used to put the braces on patients one at a time while the patient was in the chair. It's a long appointment. There's some discomfort because you've got this cheek stretcher in, and it's annoying. But now imagine being able to have this one tray that you can slip over the patient's teeth and put all of the braces on an entire arch at once. And
Yes.
so it's much more efficient, it's much more comfortable, and I can take the time to get the braces exactly where I want because I've got really good control over having this model and the braces, to where trying to do it in the patient's mouth with limited access can be tough.
Of
And
course.
so the point being is that it's also more accurate, and so it's a little bit more work behind the scenes. So when the patient comes to their appointment, they don't understand all of the steps that we've done behind the scenes to have this made, but they do realize, wow, that was easy, that was comfortable. And so that's what we do for all of our patients.
And not all doctors do indirect bonding, right? It's not just the standard practice yet.
They don't. And I think some of the reason for that is indirect bonding has been around for a long time, but that was used on plaster models when you used to take impressions. And so the
Yes.
accuracy of these models wasn't the best. And so you were sort of asking the question of, why am I doing this if it's not providing a better service? That has all changed. I would say that it's actually a minority of offices that do indirect bonding. But I think a lot of them have been left in the dark and don't understand that indirect bonding is actually much, much more accurate now. And so not only is it better, but we've talked about all the benefits for the patient as well.
All right. So for someone comparing orthodontic offices, why should they care about the technology being used in the office?
Good point. So, what I would say is that most people will go through orthodontic care just once. I was thinking the other day of, me as a parent, I'm only going to go through this parenting thing once or twice in my life with my children. And
Mm-hmm.
then you learn all of this information, but you're done having kids. And so you don't really get to apply all of these amazing things that you've
Yeah.
learned. You think, there are probably a few things that I would have potentially done different. And another example is I recently remodeled my home about 5 years ago, and I learned a bunch of things in the process of remodeling my home,
I
but I don't
bet.
plan on necessarily doing it again.
Yeah.
And the same is true with orthodontics. When you go and have braces or aligner treatment, you really don't have a reference. You don't know whether or not you're getting excellent treatment, whether the latest technology is being applied, because you've never done this before. And so I definitely think it's important for patients and parents to ask these questions of what is being used, because you don't realize that there are ways for treatment to be more comfortable, that you're going to be able to communicate with your orthodontist directly in an easier fashion, that your treatment is going to require fewer appointments. There are all of these things that this technology can provide. And I would say a majority of orthodontic offices aren't using them, but families and parents don't know that because they've never been through it before. So yeah, I appreciate us taking the time to talk about this, because I feel strongly and passionately about getting the word out as far as what's available now and how things can be so much better.
All right. So for anyone that's nervous about going into an office with all this high tech equipment, what would you say to them?
Yeah, I don't let it intimidate you. I mean, obviously, I can talk for hours about all of this technology, but realistically, like when you come into our office, you're not going to see it. It's not going to be this cold, sterile, high tech robotic office. It's going to be very warm and caring. And so, yeah, don't let the technology intimidate you. It's all for the good.
Perfect. All right, Dr. Cruz, thanks for coming on another episode of the podcast. I look forward to seeing you, talking to you again.
Thanks. Have a good one.